I'm Dr. Alok Ahuja, and I've been a professor of pathology, a private practitioner. I'm an assessor for NABL and NABH, and I'm an executive council member of the Medical Council of India. The IMC Act has been a fantastic act which has served this country very well over 70 years. The Medical Council of India had two important jobs under the Medical Council Act. Number one was the quality of medical education, and number two was ethics. Let's talk about each of them individually. But before that, you must understand that the Medical Council of India has only recommendation powers to the central government. It is not a quasi-judicial body which can take action on its own. It recommends whatever it does to the central government, which then approves or rejects it. Now, let's look at the two jobs of the Medical Council of India. Number one was medical education, quality of curriculum, quality of teachers, quality of the upgradation of medical education. You tell me, world over, 1/3 of the doctors in America are Indian doctors. The NHS and Britain, Indian doctors. Half of the Gulf, Indian doctors. Name the country around the world where Indian doctors have not made their mark. The proof is in the pudding. The quality of medical education has been so good that our doctors have gone and taken over every other medical services around the world in the last 70 years. So what is the complaint on Medical Council of India's education standards for? I don't understand. Yes, there has been a deterioration. Why? That needs to be judged. Last 20 years, private medical colleges were allowed. Medical Council of India didn't allow them. The government allowed them. 90% of them are owned by politicians. Medical Council of India did not give it to them. They are owned by them. The regulations have been arm twisted in many ways in the last 20 years. The onus falls on MCI. I'm not saying that MCI is beyond water, anything, but the question is that if its job was medical education, it has done extremely well. Second part is ethics. Definitely, the Medical Council of India needed to do much more than it could. But has anyone ever tried to understand why it could not do it? Because it did not have any suo motu. If I find someone doing something wrong, I cannot, as Medical Council of India, cannot go and take action against him unless I receive a complaint. That also goes to State Medical Council. The MCI in the center is only an appellate body. That's the functionality. So, जब तक कोई मेरे against नहीं आएगा, how am I going to go and take suo motu? At the end of it, I can maximum suspend the doctor or debar him. But do you know that MCI cannot do anything against corporates? It cannot do anything against a private limited company. 4 years back, there has been a big case against all those commissions which were caught in radiology centers, and the sting was shown on TV. MCI could not act against them. Why? Because the owners were not doctors. The owners are businessmen. So the businessmen do not come under MCI, only doctors do. MCI lost a case against a corporate hospital in Supreme Court when it took action against the corporate hospital. Why? Because the corporate hospital does not come under MCI, only the doctor does. Instead of addressing and upgrading the act of IMC, letting professional bodies autonomize, strengthening them, yes, maybe putting more people on the board, putting more nominations, putting some bureaucrats, NGOs and other thing, and trying to improve the IMC Act, government has decided that some bureaucrat has decided that let me catch and twist, put them under license Raj. Put them under license Raj. Let's make a clinical establishment act so that we can arm twist them and put them under license Raj. This is the problem, what has happened in our country. Nowhere in the world. Nowhere in the world does it happen like this. Professional bodies have autonomy, they regulate themselves, they are given powers to be quasi-judicial powers. But in this country, everything wants to run through more licensed systems, which is what happened with Clinical Establishment Act. The Clinical Establishment Act, now let me tell you something about that, is an act which has been pushed through in 2002 through the back door. While the 2G, 3G scam fights were going on, it was introduced into the Rajya Sabha without a discussion and passed. Is that fair? Are parliamentarians not going to discuss such a massive impact on healthcare? If you look at healthcare in this country, 80% of healthcare is in the private industry. The government budget is falling. The deterioration of every government hospital and every medical college is visible. The private healthcare, the private funding has improved healthcare every year since the last 25 years. Now, I agree, regulations are required. I agree that better governance is required, whether it is on pharma, whether it is on diagnostics, whether it's on purchase of material, whether it is on management of doctors, human resource, more medical college seats. Everything needs improvement, yes, on all fronts. But there are better ways to do it. Don't start throttling the best of the intelligentsia that you have. Start using them. Start taking their advice and joining them to deliver to the patients and the people. I can tell you one thing very sure, sir. 2019, definitely Mr. Modi will win the election. But 2024, that election will be fought on healthcare. It's already happened in the US. India is not too far away. It's time that we really looked at our healthcare delivery systems in a positive manner. So this is where I feel that it is important that more mind goes into it, rather than just creating acts and more licenses, more inspections, giving SSP and the DM right to raid a doctor's clinic and making rules of CEA which are absolutely nonsensical. Again, federal structure, voted, the MCI consists of approximately 100 members. 21 comes each from each state, 1 comes each from health university, elected from a health university, 1 comes elected from the electorate of each state. There are centrally elected members and a few nominated members by the central government. We are a democratic country. MCI represents democratically elected members from all over the country. Now you want to replace a democratically elected body with a 20-member nominated body. I can't understand this. You know, I mean, we talk of democracy, India, the big democracy, and you want to remove democracy and bring an MC, where all 20 members are going to be nominated by the government. They're going to be bureaucrats, NGOs, this, jo close hai to the powers to be will become members and they will regulate all colleges, everything, medical education. This is ridiculous. Come on, we need debate, we need discussion, we need to fight about it, we need to discuss it, and to remove a body which has performed so well in the last 70 years as far as quality of education is concerned is ridiculous. That's probably one of the few institutions which have worked well, and there's proof to it, and you want to replace it with a nominated body. So I think the whole concept is ridiculous. Well, I would take it first to answer this question, how Clinical Establishment Act will impact healthcare delivery in all forms. अब मुझे ये बताइए कि आज प्रॉब्लम क्या है? प्रॉब्लम ये है कि आज मेरे पेशेंट्स को ये नहीं पता कि मैं what will happen to me when I enter a nursing home. I agree with you. There needs to be more transparency. I agree with you. There needs to be more standards. I agree with you. But how to do it? This is a wrong method that the government is using. आप you utilize your intelligentsia to give better healthcare delivery to the public at large. Let's take an example of the hotels. There is a 3-star hotel. You know, before you enter it, what is going to be the quality of service, what is going to cost, what will be the cost of dal in that hotel, roughly. You'll know what a room will cost in a 3-star hotel. Similarly, you know the quality of service you'll get in a 4-star hotel. Similarly, you know that what I will expect in a 5-star hotel, right? Similarly, replicate the same in healthcare delivery systems in this country. So the problem is the common man feels cheated because he doesn't know. You have not put a star system there. If you create this star system, he will know what to get. Now I come to another point. Do you need more 5 stars in this country, or do you need more clean dhabas? You need more clean dhabas. You need nice, good, clean dhabas which gives cheap food at cheap prices. What will happen with Clinical Establishment Act? And I'll answer the question of pathology with this. They have put in rules. Small lab, medium lab, large lab. इसके पास इतनी जगह होनी चाहिए, इतना ये होना चाहिए, इतना ये होना चाहिए. No talk of what is the quality of hygiene standards which should be there. Whether you serve 5 dishes or 25 dishes, it doesn't matter. You can serve only 5 dishes, but serve them accurately with the same consistent quality and cheap. What will happen is that they have made it so tough that all the small nursing homes, the small hospitals will all finish off. What will happen is the corporates and the bureaucrats, it's a big game. They will remain. The big labs will remain. It's very easy for them. I'm an NABL accredited lab. I will remain. Why? Because I'm amongst the 1 lakh labs. There are only 800 accredited labs. I'm amongst the 800. I was 145. So I will remain. But the smaller labs will all go. Instead of trying to make sure that our health delivery reaches the masses, the poor man, and making good small dhabas which are available to people with the and medicine is knitted with the social fabric of this country. You know, the small doctor next door, at night you need your mother who cannot get up, you need a doctor to come and help you. Those are going to be history, because the small doctor will be raided by the inspector every day. Who will suffer? The common man. Believe me, in 2024 when I say election will be fought on healthcare, is because by 2024 all these small peripheral helping medical institutions, small ones, will all close with the Clinical Establishment Act. What you have to do, if I am the government, I will need to strengthen my dhabas. I will help them to attain minimum standards. I will focus on assuring that the quacks go away, the minimal standards remain. Look at MCI now. 100 quacks, 100 illegal labs. MCI cannot act on them. MCI can only act on an MBBS doctor. So what about these 100,000 illegal labs? The government is supposed to act on them. Come on. Instead of making clinical establishment, you act, I act, these act, you are just diluting it. Make it one strengthened organization which is going to provide and focus on healthcare delivery to the common man, not to the affordable man. Yeah? I mean, affordable man, to theek hai, he'll get it anywhere. But how will the common man get it? So that focus is being lost by creating the rules of Clinical Establishment Act. By making, I saw West Bengal Clinical Establishment Act the other day, where the rules of running a lab are as tough as an NABL lab. And they want everything that an NABL standard wants. NABL is the highest standard, ISO 15189. 800 labs out of 1 lakh in India have attained in 17 years. And you've got that standard put. So what have you done? You've shut all the labs, small labs, only corporate lab will run. Fair enough, let them charge. Will healthcare become cheaper or more expensive? Will you want 5 stars? Everybody can't afford a 5-star. So the government has got this whole concept of Clinical Establishment Act, anti-doctor vehemence, anti-doctor methodology, it's got it all wrong. What it would be favor is make policies to help small units, peripheral health centers, community centers, small centers, give incentive to go and work in villages. My state, for example, I look at Uttarakhand. Do you know Uttarakhand has been formed for 15 years? And out of 2,500 posts, we have only 1,200 doctors in government service. 15 years they have not been able to fill doctors. Why? Because they post everybody in the hills. We can take the doctors to the hills, give them a place to stay in, give them an extra bonus to go and work there. By saying that we'll give you more PG seats is not the way. 3 years I'm going to sweat it out, I'm come back and I'm going to hurt people. Let's do something which is judicious. And the medical council, which has done medical education, which is representative of the doctors, is the best body to take this forward. By getting bureaucratic and laws and judiciary and trying to tighten reins, we are all together, government, the doctors and the government, we the people, and the government is for the people, of the people, for the people. So let's all move together to improve healthcare delivery systems rather than put laws how to put people behind bars. That's the difference between IMC Act, Clinical Establishment Act, the behavior today and the behavior that should be. I hope I make my point clear, sir.